Anatomy of Trauma. Our keynote session today is entitled Anatomy of Trauma, How Trauma Affects Mind, Body, and Spirit, presented by Jill Richards. Jill Richards is a doctor of acupuncture who is licensed by the Oregon Medical Board. Jill is a 1994 graduate of the United States Naval Academy. She earned a Master's of Engineering in Biomedical Engineering and a Bachelor's of Arts in Gender Studies, Cum Laude, from the University of Utah. She completed her initial master's level acupuncture training at Middle Way Acupuncture Institute and earned her doctorate at Pacific College of Oriental Medicine. Clearly, she likes school. A P-3C naval flight officer, Jill still serves as a reservist and conducts research for the Office of Naval Research on acupuncture's efficiency in treating PTSD and phantom limb pain. Jill is the chair of the Health and Healing Program area for the USNA Women Shared Interest Group and is active with the Survivor Advocacy Network. Although she specializes in orthopedics, women's health, and trauma intervention, Jill is eager to partner with anyone who is not living optimally in body, mind, and spirit to catalyze their respective journeys to whole health. You may submit questions throughout Jill's presentation using the chat function. The Zoom co-host will ask on your behalf. We will stop the recording of this presentation with 10 minutes remaining in the session for Q&A. At that point, you can also use the raise hand function to ask questions yourself. If I see a raised hand, I will call on you. Please remember, if you want to break with one of our counselors, just use the chat feature and directly message Safe Space. Thank you, Jill. The floor is yours, and we are all looking forward to it.
Cassie, thank you for that gracious introduction. I want to make sure that my screen is being shared. Can you see that? Awesome. Okay. Good morning from Seattle. My name is Jillian Richards, and I'm a doctor of acupuncture here in the Pacific Northwest. I'm usually in Bend, but up here for our son, he's a freshman Husky, and it is Parents' Weekend. First of all, I want to applaud you all for your strength and courage to be here today. And it is truly my honor to share this time with you. Trauma intervention and fostering resiliency in survivors, regardless of the time delay since the initiating incident, is the most important and rewarding work I've been privileged to do. It feeds my soul to be able to journey with folks who are unsettled by so many of the accompanying dysregulated symptoms in body, mind, and spirit. In addition to a host of physiological and neurobiological post-trauma symptom constellations that we'll discuss shortly, there's a wide range of emotions that can simultaneously manifest. Anger, frustration, anxiety, grief, sadness, guilt, feeling adrift. All of these are normal emotional responses to a traumatic event. The goal is not to become mired in these responses, but invite your system to healthfully move forward through the experience. Of course, there's nothing that can be said or done to unexperience a trauma, but there are ways that will change your relationship to your experience and help you move forward. I'm honored to be here today at this virtual retreat sponsored by the USNA Alumni Association Women Shared Interest Group. Everyone involved in this retreat is sharing a little about what each of us does to help trauma survivors move forward through their respective experiences. I'd like to spend some time with you today sharing my journey with trauma survivors as informed by the tenets of East Asian medicine and neurosomatic intelligence, and how that may be able to assist you on your respective journeys. With that said, here's a brief overview of what I will cover today. So I will talk a little bit about my background so you know where I'm coming from. We'll breathe together more. Yes, Jennifer, yes. Thank you so much for starting us off with some great breath work. After we breathe together, I'll talk about trauma and resiliency from an East Asian medical perspective and how that may overlap with other perspectives. And then I'm really eager to discuss the many ways that trauma can manifest in body, mind, and spirit. Most importantly, I think, introducing you to the why behind these manifestations. I'll then give a brief overview of this millennial old style of medicine that I practice and look at the science behind acupuncture's efficacy. I'll also touch on an East meets West approach known as the Tao of Trauma before introducing neurosomatic intelligence. Then we're going to spend a little bit of time honing your toolkit for self-care, and that will help you build your resiliency. And I'll talk about that from both a macro perspective and then offer an acupressure protocol to help you shore up your boundaries. And as we move through our discussion today and over the next couple of days, I guess that would only be 2, yes, today and tomorrow, we'll talk more about symptom management. So, wow, that's a busy slide. Everyone's got a cool slide like this, one that represents a journey, and one that's not specifically illustrated here is my personal journey with trauma. So I'd like to talk a little bit about that. As is the case with many people, trauma is part of my genetic inheritance. My father was a childhood POW in a World War II Japanese prison camp in Indonesia, and perhaps less ghastly, but certainly no less formative, my mother survived the devastation of a small town parental divorce in the 1950s. My initial firsthand experience with trauma manifested while deployed to Southeast Asia in 1994 plus 5. That mighty P3, there she is, protecting tomorrow with yesterday. For those of you who are not Navy, the P3's job was, she's since been retired and replaced by the P8. Her job was to hunt and kill submarines. And on my last deployment, I flew 4 search and rescue missions and coordinated the rescue efforts for 73 people. However, our crew wasn't able to save everyone. And although we rescued 44, this was a shortcoming that each of my crew experienced uniquely as our own personal data points with PTSD. Only 3 months later, I was in a near-fatal rollover motor vehicle accident post-deployment, and my injuries permanently grounded me from flying. And this experience served as a very, very personal second data point on trauma as I worked through the lengthy recovery from a broken neck and healing traumatic brain injury. As the ultimate participant observer in the extensive healing process following both traumatic experiences, I learned and pursued alternative treatment approaches. It was that or get on pain meds at age 26. That was not okay. So this was certainly an extremely impactful experience and certainly planted the seeds for me to later become a healthcare provider and work with my fellow trauma survivors. Although I was unable to fly after the accident, I've been able to continue my service as a Navy reservist. And Cassie was so kind to mention, I'm doing acupuncture research for the Department of the Navy and looking at how it can treat PTSD and phantom limb pain. Now, these studies grew out of my clinical work that ended up with a lot of trauma survivors. I opened a complementary medicine clinic at the Naval Academy while I was teaching engineering there. And what I realized is trauma survivors responded beautifully to acupuncture and was able to journey beside folks as they move through their trauma. So I'm currently working with both the DoD and the VA to make this style of medicine more readily available to all uniformed personnel, past and present, especially those trauma survivors who desperately need it. So that's my background. Now, Jennifer, let's breathe together. All right, we're going to do this a little bit differently than that amazing introduction we just had. So I will ask you to put your feet on the floor, right? Shouldn't be too hard since you just did this. Put your feet flat on the floor and you can place your hand on your belly or not, whatever's going to serve you. And the goal with each breath is we're going to work to fill your belly with air, right? That's why I like to put my hand on my belly. And pause for a count of 3 and use all the muscles of your core to try and put the back of your navel on the front of your spine. Okay, it's probably not going to happen, but that's the movement that we are going for. Okay, let's give it a shot. So let's have you put your feet flat on the floor, close your eyes or not, whatever serves you. And let's take a nice deep breath in. And exhale, engaging all the muscles of your core. Work to put your navel on your spine. Awesome. Let's do it again. Nice deep breath in. Pause, relax your shoulders, and exhale. Take another nice deep breath in. Pause. And exhale again, engaging all the muscles of your core. Work to try and put your navel on your spine. Take another nice deep breath in. Pause. Relax your eyeballs. And exhale. And one more nice deep breath in. Fill your bellies with air. Pause. And exhale. Awesome. Okay, now we can begin. All right, so what is trauma? Man, that's a really great question. There are so many ways to define it. And in fact, the experts don't necessarily agree. So the latest version of the Diagnostic and Statistic Manual of Mental Disorders, or DSM-5, took many years to evolve into an effective definition, and that is really not entirely agreed upon. What they state is that a traumatic event is one where actual or threatened death, serious injury, or sexual violence occurs. And Dr. Bessel van der Kolk, who wrote the book, How the Body Keeps the Score, the body keeps the score, not how, the body keeps the score, simply states that it's an experience that overwhelms a system's ability to cope. My favorite definition of trauma is from a colleague and mentor of mine, Elaine Duncan, who's a licensed acupuncturist, and we'll talk a lot about her work a little bit later. But what she says is trauma is simply too much, too fast, without enough support. And I think that nails it. My big takeaway, what I want everybody to recognize, though, is that trauma is simply that which initiates a protective response. This is a protective response. Your body is trying to protect you. And this, according to Dr. Peter Levine, we'll talk about his work shortly, may simply go awry. So trauma, of course, being exposed to a traumatic event does not mean that you will develop PTSD, and that's important to note. So furthermore, the DSM-5 also states that you need to have a qualifying exposure, either direct personal exposure, witness this trauma to others, or have indirect exposure through that of a loved one. And that is a very, very real experience of trauma. Trauma does not discriminate. Doesn't care who you are, doesn't care who you voted for. Please vote, by the way. It doesn't care where you grew up. It doesn't care what service you were in. It doesn't care about any of those things. It will sink its hooks into anyone. And those hooks are gnarly and need some very specific work to release those. So what is PTSD? I think maybe a more interesting question is, why do some people develop PTSD and some people don't after witnessing the same event? Well, I think there are many things at play here. And during the course of my research, I had good fortune to talk with one of the Wounded Warrior Battalion officers out in San Diego. He said, Jill, there seems to be no rhyme or reason why my Marines have developed PTSD. So I've got a Marine who, he lost a limb in an IED explosion, but that's not why he has PTSD. He has PTSD from hanging out with a bunch of his friends in the chow hall. They took an incoming mortar and his friends died. And I suggested that actually, I think it all comes down to boundaries. His Marine's boundaries remained intact, defining his relationship to his injuries, right? Lost a limb. That was an unexpected or possibly an expected cost of doing business, right? Yet his boundaries were violated when death unexpectedly occurred in a supposedly safe space. So I think it's important to recognize that because our boundaries are unique to each of us and continue to evolve through our life experiences, it's very important to acknowledge that what everybody may witness is the same. You will experience it very, very differently. Now, there's one piece of post-traumatic stress disorder, PTSD, that I want to touch in because there's been some discussion that it's not a disorder. And I wholeheartedly disagree, because what it means is it's your body's natural protective response that becomes disordered. And maybe dysregulated is a better way of saying that. So I like post-traumatic system dysregulation as a better way of thinking about that. Now, keep in mind, it is just an interruption in the natural process, as Dr. Peter Levine says, processing. So let's take a peek at what some of the experts have to say about this. In his book, Waking the Tiger, Healing Trauma, which is by Dr. Peter Levine, fantastic book if you have not read it, he discusses what happens with the body system. And I'm going to talk a little bit more about that in a few minutes. This is not a pathological condition. What your system experiences when it gets hung up, gets arrested in this natural process of processing, is just a system that has gone awry. And that can be changed. You can bring your system back into regulation, and we'll talk about that as we go through our discussion today. So we heard a little bit from Dr. Peter Levine, Dr. Bessel van der Kolk, which is great, but I like to go with the wisdom of our breathing buddies, our trees. If you are to cut down a tree, hopefully you made it through 3rd grade, and you know that if you count the rings of the tree, you know how old the tree is. Well, arborists are way savvy to what the tree's life really looks like. And they can look at the tree stump and see where there was a flood, where there was moth infestation, where there was a fire. All of the tree's experiences are inscribed in their tissues. And we are no different. All of our experiences are written in our tissues. And again, if this natural process of processing does not move through us, our experiences can get trapped and confined within our tissues. So therefore, release work is really, really important to become grounded again so you can effectively process experiences. And before we can explore these avenues of release work, let's talk a little bit about how PTSD can manifest. Oh, I'm getting ahead of myself. Regardless of the type of event, anyone can develop PTSD. It is not a measure of your intestinal fortitude, none of those things. Anyone whose boundaries are violated can develop PTSD. And while these manifestations of PTSD are unique to each individual, and the DSM-5 suggests a handful of common symptoms, and that's it, upon reviewing the current medical literature, one can see that trauma has far more reaching effects in body, mind, and spirit. So I'd like you to think of these manifestations in body, mind, and spirit as simply outputs of the nervous system, whose number one job is to keep you alive and to keep you safe. Also to make you move, but number one job is to keep you alive and to keep you safe. These outputs that are generated by your nervous system are to get your attention and spur you into action to make you feel more safe. So let's first talk about the physical manifestations of trauma in the body. So my favorite output of the nervous system is pain. Pain, that'll get your attention pretty darn quick. Now, pain can be localized or it can be all over the body. Fibromyalgia is a very common diagnosis for folks who have experienced trauma. Migraines, a very specific form of pain, also quite common for folks who have experienced trauma. And again, trauma does not have to be trauma with a capital T. It's just too much, too fast, without enough support. Pain can also set up in your TMJ, right? So you can have dysfunction here. Autoimmune disorders are quite common. And in fact, there was a recent study by Sue and his friends that talked about how thyroid dysfunction is very common among trauma survivors. In fact, I can't remember, I think it's somewhere around 3 times. You have 3 times the likelihood of developing a thyroid disorder if you have experienced a traumatic event. So all sorts of autoimmune diseases, lupus, another common one, digestive dis-ease, and I wrote that very specifically that way, that can manifest as IBS, can progress into Crohn's disease, celiac, you name it. Disrupted sleep, so having difficulty falling asleep and or staying asleep, like, oh, look, it's 1:14. Again, I'm wide awake. Nightmares, night sweats, all of these things serve to disrupt your nighttime rest, which is very important for you to be able to process the experiences of your day. I really like this turn of phrase that my cousin gave me. When you're feeling lethargic, I can't want to do anything. Or I'm utterly exhausted. I have nothing in my tank to be able to participate. There are metabolic changes that can lead to either weight gain or weight loss. Panic attacks are very common, which is an overwhelming sense of dread. It can be heart racing, it can be sweating, it can be overcome by emotions. So many things can be rolled up into experiencing panic attacks. Changes in vision are quite common, usually not going in the good direction, but moving away. Sexual dysfunction, very common, and irregular menstrual cycles. Also, these are not by any means the whole of how PTSD can manifest, but these are some of the many ways that it can show up in your body. So let's move on to the neurological manifestations of trauma in the mind. And there are 2 times I want to call attention to. One is what happens when you're actually experiencing a trauma. What happens when your system's being overwhelmed? Well, first, your system dumps cortisol and adrenaline in, and the cortisol will shut off the function of the hippocampus, which leads to a decreased ability to integrate what you're experiencing. And then the adrenaline increases the function of the amygdala, which makes you have very specific key memories that are imprinted in your brain. So it's kind of a double whammy. You're getting all these memories, or these very, very clear captured snapshots, but you're not able to integrate them. So now what happens in the wake of a trauma is you have dissociation. Very, very common. That can show up as just zoning out, inability to establish short-term memories, or it can be excessive compartmentalization. I've got a trauma survivor I'm working with right now, and she said, I don't get it. Like, I was Wonder Woman before. I was able to do anything. I said, yes, you were. But were you fully experiencing life? And she said, no, I wasn't. So being able to compartmentalize, which is applauded in the military, absolutely, yet that can come into conflict with your ability to move through your experiences. There's also impaired integration between your primitive, emotional, and thinking brain, and a disagreement, perhaps, between your left and right sides of your brain and body coordination. So that is very difficult to look at. The left and right sides of your brain control the opposite sides of your body. And I've had many trauma survivors tell me, it feels like my left and right sides of my body belong to 2 different people and they're just stapled together. So that is also a common experience. And last, but certainly not least, the psycho-emotional manifestations of trauma in spirit. So you may have felt one or all of these, or simultaneously, what these experiences feel like, right? There can be anger directed towards self. I can't believe I put myself in that situation, or at others. How could you? Certainly with a perpetrator or people around, you can become very short-fused. There's grief often a lot of people don't make the opportunity to grieve for your before self, right? That loss, that's very real. Shame or self-blaming is common. Anxiety, so having a decreased threshold or tolerance for other stressors. Being hypervigilant, or I should say being imbalanced with fear. And that can show up with hypervigilance. It can show up with being agoraphobic. I don't want to even leave my house. Or it can be a total absence of fear. So maybe finding relationships that are destructive. It could be putting yourself in situations where you don't really care what the outcome is. That is common. Sexual dysfunction, again, can be impact your psycho-emotional space. And then I want to touch on this one because this is not surprising, but can impact you considerably. One is to develop a one-sided contract with the perpetrator as a catalyst for healing. And my father, who is, he's almost 80 years out from his incarceration as a POW, and he is still waiting for the Japanese government to apologize for their treatment of the POWs. I said, Dad, pretty sure that's not going to happen. And he's still waiting for that to initiate his ability to heal. I just want to go back to the before time. That's another one. Everything is fine, everything is fine, everything is fine until it's not. And that's when the body says no, which is another fantastic book by Gerber Mate. So that's what we are looking at in body, mind, and spirit. Now let's take a peek at what the experts have to say about healing PTSD. Well, trauma can scramble your whole system. Here is the good news. You do not have to stay in that dysregulated space. So I mentioned epigenetics a little bit earlier, and I want to talk more specifically about that relatively recent discipline within genetics. So gene expression is more than just the traits that you inherited from your biological parents. The CDC defines it as the study of how your behaviors and environment can cause changes that affect the way your genes work. So this does not change your DNA, but it does change how your DNA will produce proteins, and that initiates a whole cascade of other effects. So the best part is these changes are not permanent. They are reversible. So we know that our systems can become dysregulated in the response to a trauma. They can be invited to return to a regulated state. In 1994, it's true, it was 94, not just a great year, but 1994, Dr. Stephen Porges published a new way to look at trauma response through the lens of polyvagal theory. And I'd like to give you a brief overview of the very complicated dynamics that make up our nervous system through this lens. Before Dr. Porges' paper, it was understood that there were only two accepted aspects of the nervous system: our sympathetic nervous system that governs the fight or flight response, so we can fight or hopefully outrun the saber-toothed tiger chasing us, and the parasympathetic nervous system that governs the rest digest phase. According to polyvagal theory, there's a little more to the parasympathetic nervous system, which is regulated by the 10th cranial or vagus nerve. This nerve originates in the brainstorm and has two branches: the ventral vagus that innervates the organs above the diaphragm and regulates our social engagement relative to our tribe, and the dorsal vagus, which runs down the back, that innervates the organs below the diaphragm. Together, these branches serve as two brakes for the sympathetic nervous system, with the ventral vagus working as a gentle, nuanced brake, and the dorsal vagus serving as an emergency brake that rapidly will kick you from fight or flight into freeze. So how does this actually work? In response to threat, the ventral vagus releases the brake. So, what is that? The ventral vagus releases the brake on the sympathetic nervous system, which becomes more active and mobilizes response for self-protection. Like, what was that? Now, one will you'll kick you into fight or flight until it is no longer physically safe to be in fight or flight, right? If your body says, we are going to have a heart attack, then the dorsal vagus nerve kicks in to affect freezing. And this can manifest in so many different ways. There are many trauma survivors who struggle with shame, the shame of shutting down in the middle of a traumatic event. And I assure you, this is your nervous system. She is just protecting you. You could not overthink that or come up with a different way forward. This is your nervous system protecting you, a normal self-protective response. However, while both the sympathetic nervous system and the dorsal vagus are trying to control a situation, it's not unlike having your foot flooring the gas and having the emergency brake engaged, which means you can be stuck in chronic hyperarousal while being trapped in a freeze response. So that is very difficult to manage because it looks different for everybody. And now you've got these constellation of symptoms, and we'll talk about that in a moment. Now, Dr. Peter Levine, who developed somatic experiencing as a method of trauma intervention, he explored the threat response cycle in prey-predator relationships. And he noted that humans, we are animals, react the same way with 5 distinct steps. There's the arrest startle, ooh, what was that? There's defensive orienting, ooh, what's coming for me? The self-protective response, that's that fight or flight or freeze that we just talked about. Then you complete the event and then you integrate it. Ooh, I'm maybe not going to go to that watering hole anymore, right? As a rabbit, because I just almost got swooped by a hawk. The rabbit does not give any more thoughts to it. It does not have toxic shame about almost being swept up by a hawk, right? This is something that as humans, we manage to get stuck in our own heads. So of course, Dr. Levine says that this process can be thwarted along the way with associated physiological manifestations. Now we're going to get to one of my favorite discussions. So again, trauma can scramble your whole system, but you do not have to stay in that dysregulated space. So Elaine Duncan, who's a licensed acupuncturist, she wrote the book, The Tao of Trauma. She worked for over 30 years with the VA on trauma intervention. And this book that she wrote integrates East Asian medicine with Western trauma treatment. Now, I've had the good fortune to study with Elaine, and hers is my preferred definition of trauma. I'm going to say it again. Too much, too fast, without enough support. Now, building on both Dr. Porter's polyvagal theory and Dr. Levine's somatic experiencing models, I really appreciate her description of trauma's impact. If you think about the nuanced interaction between the sympathetic nervous system and the ventral vagus as having this slow rolling reaction to the ups and downs of normal everyday life, it can be thought of as a sine wave. You can also think about everyone having a zone of resiliency, right? So that hopefully encapsulates that normal ups and downs of daily life. However, when you experience a threat, the ventral vagus brake comes off and the sympathetic nervous system revs up into fight or flight, which is where you're going to stay until right here, right? You'll stay in fight or flight until you either outrun the saber-toothed tiger or punch it in its nose. I don't know if that would be successful. And then you can spool down and integrate the experience. And, or you'll go into when you're in hyperarousal, if your system says no, if you stay here, you're going to have a cardiac arrest. So survival becomes questionable and you drop into parasympathetic activation where you stay in the stuck off position. So this process can look different for everyone, and yet people often tend to dissociate, check out of their bodies entirely, which can set you up for a host of challenging symptoms. Trauma, right? So you can ping back and forth. Okay, I get these migraines, but then I can't get out of bed. I'm having panic attacks, but then I can't digest any food. So it's really hard to figure out what is happening in my body, and it's equally challenging for your providers to help you navigate that. So trauma, especially repeated traumas, can also shrink your zone of resiliency so that everyday experiences repeatedly cause you to oscillate between sympathetic hyperarousal and parasympathetic activation, again, making it infinitely frustrating to make heads or tails of what's happening in your system. So now that we have a little bit better understanding of how our nervous system operates, let's talk about resiliency. I love this. I'm getting ahead of myself again. Let's talk about how we can ride this wave. So, Jennifer, I am so glad that you talked about getting to this space that, with your kids, feeling the sunlight and the warmth and just basking in this loving space. That's where I'm going to invite you to go. But first, before we do that, let's all call to mind an irritating, just an irritation from the past week or two. For me, it was getting to sit next to a hacking individual on an airplane. That was mildly irritating since I got COVID from that experience. So that was mildly irritating. But let's find something that's just kind of annoying. You get to Starbucks and they are all out of your pumpkin latte. Dang it! Let's find one of those. And now just sit with that and let's see, what is your body telling you about that irritation? Do you feel like a little tightness in your belly? Maybe a tightness in your chest? Maybe your brow is, oh, look at that. Brow is wrinkling up. Dang it, COVID. Yeah, just take note. What is your body doing in response to this mild irritation? Okay. Now let's go to that space that Jennifer invited us to find, that incredible space. And let's bring a loved one, and it can be a physical person who's still alive. It can be your great-grandmother whom you never met. It can be the divine. It can be anybody. Let's have somebody come to join you in that amazing moment and just share in that unconditional love. I want to wrap myself around it. Good. Okay. Now that we have that, take note of what your system is saying. Feel what that is like. Okay. I love that. My belly is soft and relaxed. My chest is open. Oh, look, no furrows. No furrowing. Okay, now let's invite that lack of pumpkin latte to come back in, or whatever your mild irritation was. And let's feel your system in response to that. And in my own system, I'm feeling my abdomen is still staying open, no tension. Just like, oh, that's what happened. Okay. Okay, my chest is nice and open. No threatened constriction of my throat. No furrowing. All of those things. So take note of how your body experiences that mild irritation. Okay. So, you know what that means? We've just done it. We have just ridden that wave. That wave is available to you all the time. This lovely dance between your sympathetic and your parasympathetic nervous system, always open to you, always available to you. And a lovely way to do that is to go to that space where you feel that unconditional love. And then check in with that minor irritation. Not a big one, just a minor irritation. Okay, so now let's talk about resiliency. This is not me. I wish it was. I'm not that brave. El Google tells us the capacity to recover quickly from difficulties is resiliency, and epigenetics is redefining our understanding of what resiliency looks like. From an East Asian medical perspective, it all comes down to balance. And there are 3 ways to foster resiliency in trauma intervention, right? We talked about trauma getting its hooks into you. So one of the most important ways is to do release work. And that can be done a number of ways, and I'll talk about that in a moment. And then you need to work to reestablish this balance to increase that zone of resiliency, also known as the window of tolerance. Maybe some of you have heard of it that way. And then establish some self-care to facilitate maintaining that balance. Very important. So these require you to be present in your body. Now, why is that so hard, especially for this particular audience? Because the military is really, really great at asking us to check out of our systems, right? I'm hungry. Chow hall is not open. You are not hungry. Okay, I'm not hungry. My ankle hurts. You better rub some dirt in it and strap up those boots, because I don't have time for your ankle. We've got a mission to do. Suck it up, buttercup, right? Military says, check out of your systems. We do not want you present. I need you to do a job. And that's great. We can compartmentalize that and we can execute mission. Fantastic. However, the military doesn't do such a good job at inviting us to come back into our systems. So especially for this particular audience, being present in your system can be a terrifying place. Your body has not always been a safe place. So I recognize that this is a big ask to train to be present in your system. Now you can learn how to honor your system and build capacity and space in your nervous system, and you can do that in lots of different ways. The Tao of Trauma, that learning to ride that wave, that's one, and I'll talk a little bit more about that in a breakout session. Acupuncture and acupressure are fantastic ways to do that. I'll touch on that in a little bit. And Dr. Seneca Vaughn, Doctor of Acupuncture and Oriental Medicine, and West Point, we love her anyway, OT5 is, she's going to talk about that in a breakout session. I'll touch on neurosomatic intelligence, and Dr. Kristen Barnes, who's a naturopath and a licensed acupuncturist, will be talking about that. Yoga, of course, Dr. Jennifer Dietz is going to be talking about that. And here are a few others. And Alana is going to be talking about nutrition. And I don't believe we have anybody on biofeedback today. But these are all great ways to build capacity and space in your nervous system to expand that window of tolerance or that zone of resiliency to honor your nervous system. So this is important to take away. You know how to do this. Your soul knows how to do this. We are wired to do this. We're here to help you remember how to do that. So with that, let's talk a little bit about East Asian medicine. This is my favorite discussion item. Unfortunately, we're not in person because I'd love to hear what people think it is that I do with these needles, right? I've heard everything from dunno to voodoo. So it's always interesting for me to hear. So what's it good for? It is good for the human experience. 3 words, the human experience. It's great for stress relief. Most people associate it with its use with pain management, and acupuncture is a very well accepted intervention for pain management. In fact, there was an article that was put out in the Journal of Emergency Medicine in 2016 that compared acupuncture's use to morphine in a acute pain management in an ER setting, and acupuncture blew morphine away, which, in case you've had your head in the sand, we're in an ongoing opioid epidemic in our country. So this is really great news and really big news. And while it is good for pain management, it can also be used to help heal from trauma in body, mind, and spirit. So how does it work? We're going to talk very briefly about working biomedical theories and East Asian medical theories. So boom, a lot of information on this slide. I'm not going to talk about any of these theories. I'm going to let you know that all together, we don't have a good idea of how it works. We really don't understand. We don't have the technology to explain what happens at the cellular level for why acupuncture works. What we do know is that we've got thousands of years of demonstrated effect, and it's much easier if I describe it through an East Asian medical lens. Oh, I always forget. Let's talk about a few other scientific studies. So there was a randomized control that was took a look at acupuncture and CBT and waitlist to see how it treated PTSD. And acupuncture provided a large treatment effect similar to cognitive behavioral therapy. Both outperformed the waitlist control, and symptom reduction was maintained at a 3-month follow-up. There is positive evidence with caution, and that just means that we don't have enough studies yet to provide overwhelming support for using acupuncture to treat PTSD, but it's coming. And the best part is because acupuncture is very much a patient-specific approach to interacting with the whole system, body, mind, and spirit, it is an ideal treatment for patient-specific manifestations of PTSD. All right, now we're getting into the East Asian medical perspective. So it's really important to understand that East Asian medical theory is very similar in one particular way to Western approaches, right? From the Western perspective, we know that the body's goal is to maintain homeostasis, right? We need to operate within a very narrow window for blood sugar, body temperature, blood pressure, etc. In East Asian medical theory, there's an additional aspect, qi, or life force energy, that flows through a very well-documented circuit throughout the body. Now, this circuit, if you think of it, let me step back. According to East Asian medical theory, if you have perfectly smooth flowing energy, you'll never get any older and you'll never die. Awesome. The problem is we're human, and the experiences that we have, both chosen and not chosen, impact the way we live in our bodies. And so this nice smooth flow of qi gets disrupted. So think of it as like a garden hose, where you can get a kink along this smooth flowing energy, which means you get too much energy before the kink and not enough afterwards. And these local and sometimes systemic imbalances that come from that can set up some dysfunction in your system, and it sets up dysfunction in body, mind, and spirit. So to clear these imbalances, acupuncturists use tiny little single-use disposable needles to help open these blockages. The best part is it just reminds the body how she's supposed to heal, how she's supposed to be balanced to heal herself, which, of course, is a great definition of resiliency. So there are two ways that I talked about hook release. There are two protocols that I like to use. One is the NADA protocol, which makes it sound like nothing. But that one, and I always get the A's mixed up. North American Acupuncture. Nope, we'll just say, we'll just leave it at that. NADA protocol. National Acupuncture Detox Association. Yes, there are 5 needles in each oar to support the major organ systems and restore balance. This was developed in the 1970s to help people who were struggling with substance abuse and is currently used in methadone clinics. One of the unintended side effects was, oh, my PTSD symptoms are resolving, which I like that one. That's pretty fantastic unintended side effect. It is now used to treat PTSD, and there's a group called Acupuncturists Without Borders that are mobilized to support folks. They have people right now in North Carolina, in Asheville. They've got people down in Florida. And this group comes and treats people in mass. There are also a series of military stress recovery clinics that are associated with Acupuncturists Without Borders, and they offer acupuncture for free to veterans and their families. So that's really important. I think there are 42, maybe 43 clinics now across the country that offer this free service to our veteran population, which is awesome. The next protocol I like to use, I refer to as the 7 gates, and this is called for when you are consumed by something. So I use 7 needles. These are 3 of the points, 2 are on the quads and 2 are in the ankles. And these 7 needles open 7 gates to allow your chi to reestablish balanced flow. It really serves as a lovely, if you have to open up a steam valve to bleed off excess pressure, this is a great way to do it. Provides a system reboot, and it's a follow-up. I close the gates using the boundary points. We're going to talk about those in just a second. So looking at resiliency overall, right? This is great. Pretty straightforward. We want to bring good energy in, right? So we don't have a huge processing load on body, mind, and spirit so that you'll get good energy out, which hopefully you'll use to engage in activities that feed your soul. More specifically, you bring that good energy in. So eating cleanly, right? Minimizing the heavy load on your liver, and I don't just mean alcohol. Detoxify your life. So in each of our organ systems, so that's not just the physical organ, but the energetics that run through it. Each of our organ systems from the East Asian medical perspective means that there's an emotional component as well. And the liver's job is to detoxify your life, not just food and drink, but also the experiences you have. So doing liver support is really important, and we'll talk about that in the Tao of Trauma work later on. Whole body physical activity, right? Yoga and Tai Chi are beautiful ways to do that. Meditation and movement is what Master Chen, my Tai Chi master, describes it as. Maintaining healthy sleep hygiene, very important. This one, a lot of people, a lot of women especially struggle to do something every day that feeds your soul. This is your gift to you. Do it before you jump into the crazy of your day. Do something that feeds your soul. I'm studying Scottish Gaelic, maybe, so in case I meet Jamie on a hillside around standing stones, I can talk to him. But this is something I do for me. There are only like 50,000 people who speak it in the world, and chances of my coming across them in the Pacific Northwest are close to 0. But this is something I do for me every morning before I start my day. Engage in social activities, and then of course, vitamin N, my favorite. Go out and be in nature. Go out and be in nature. You know, in Scandinavia, they actually prescribe that as if you ever present with any sort of mental health concerns, your prescription to go spend 2 weeks in nature is where you need to start. Your boss has to honor it. Your family has to honor it. Go be 2 weeks in nature. And surprisingly, people feel pretty great when they come back. All right, so let's talk about an acupressure protocol for shoring up one's boundaries. We talked about how PTSD develops out of having one's boundaries violated. So all trauma survivors can use this acupressure protocol. And these are the boundary points, the internal and exterior, the interior and exterior gates of the body. So how do you find these? You find them by taking 3 fingers up from your wrist crease, right, on the inside of your wrist, and go right in between those 2 tendons. Oh, you fall right into a little hole there. You can put your thumb there, and then put your pointer finger on the opposite side. And that is how you find the interior and exterior gate. So the pericardium is para meaning around, cardium meaning heart. This is your heart protector. Very, very important channel to give support. So you find your gates, hold these, and take 5 deep breaths. Okay, just like we practiced at the beginning. And in the interest of time, we're gonna move through that. Diaphragmatic breathing, again, invites a shift from that fight or flight place governed by the sympathetic nervous system into the rest, digest place, parasympathetic. And these points are wonderful. This one's also very good for nausea. So if you ever wrestle with motion sickness, that's the point. The people who may have the bands that sell in CVS and Walgreens, yeah, they borrowed that from East Asian medicine. Wish I'd have thought of it. Okay, so we're not going to do that breathe. Here are a series of other symptoms that you can manage with acupressure, and Dr. Seneca Bond is going to be talking about that in one of our breakout sessions. So I want to talk a little bit about neurosomatic intelligence, and we'll talk about why this is so important. So again, it's important to recognize that our nervous systems are neuroplastic. We are neuroplastic beings. That means we are constantly rewiring our nervous system all day, every day until you draw your last breath. Again, your nervous system jobs, one, keep you alive, and two, keep you safe. Or sorry, keep you alive and keep you safe, and two, make you move so that you will be alive and safe. Right? Just to put this in perspective on what a huge drain this is on your system. Every second, your system gets 400 billion inputs. Holy cow, it's amazing we can even function, right? In order to function, we've got this incredible network that whittles things down to about 2,000. These 2,000 things are going to keep me alive and keep me safe. This is what I need to pay attention to. Of those 2,000, 40 will come to the level of subconscious thought, and 5 will come up to the level of conscious thought. And these will lead to an output of your nervous system. And this could be pain, migraines, nausea, anxiety, all of these things. So you can actually change how your nervous system operates. It's pretty amazing, right? You can retrain your nervous system to pay attention to different things, to process differently. And my favorite, let's choose different outputs because I don't like the migraines. Let's have different outputs. So pretty amazing how you can do that. Let's practice that. Let's get to know our nervous systems a little bit and take them for a test drive. Oh, here are some nervous system outputs. All the way to the left, here are when you are in survival mode, and you cannot simultaneously exist by being in survival mode and being in performance mode. It is impossible. So when you are in survival mode, the outputs that you tend towards are pain, anxiety, depression, fatigue, those Fs that we're all familiar with. Where we'd like to go is the outputs that are on the performance side: coordination, balance, immune system response, health, and great sleep. That's what we're looking for. Okay, so we've talked a little bit. Let's do a quick discussion of we're going to do one quick nervous system assessment. And then we're going to jump into questions right after that. So with neurosomatic intelligence, what you do first is you assess where your nervous system is. You do a range of motion test because, as we talked about earlier, when your sympathetic nervous system is engaged, you get ready to react. You get ready to go into fight, flight, or freeze, right? And so you lock down and your range of motion decreases. So you can think of range of motion as an ease, a barometer of the ease in your nervous system. So a good range of motion, you can either use the rotation of your shoulder, or like this one, I'm in a twisty chair, but if you lock that and you put your arms right in front of you, you can rotate as far as you can to the right, and then come back as far as you can to the left. Just take note of where you are. This is just a snapshot of where your nervous system is. Now we're going to introduce a neuro tool. We're going to grab the tragus of one ear. I'm going to pick my right side. Tragus, and this is that little flap thing in the front of your ear. And you're going to grab it and just gently pull straight out. We'll do about 30 seconds. See what that's like. Oh, my nervous system says thank you. Okay. Let's release that. And now let's do that range of motion test again. Let's see what, oh, and I got a pop. Oh, my system says thank you. So we're not going to do this, but you can check the other side. What does it feel like? Because your left and right tragus pull will impact your nervous system a little bit differently. So what we are doing here is hopefully identifying some tools that can calm your nervous system, and then you can introduce those into your daily life. And you can learn more about neurosomatic intelligence during a breakout session with Dr. Kristen Barnes, who's both a naturopath and a licensed acupuncturist. Okay, so we've done a lot of discussion today, and I wanted to open the opportunity to answer some questions.